Assalamu alaikum. I hope so you're doing fine. I'm Dr. Muhammad Ali Rabani and today we are going to discuss the extensor compartment of the leg. First, let's start with the overview of the extensor compartment of the leg. We will talk about the surface landmarks, the subcutaneous tissue that is also called superficial fascia, and the structures that are contained within it including the veins, lymphatics and nerves. Deep fascia and its special condensation at the lower end called extensor retinacula, the boundaries of the compartment and the contents of the compartment. Then we will further go into the detail of each of the contents. Surface landmarks, the things that you are going to find out, you are going to easily palpate the condyles of the tibia right here. It's not exactly shown very much nicely in the picture, but you can easily palpate them on the each side of your knee joint. On the front, you can find the tibial tuberosity where the patellar ligament gets inserted. On the posterolateral aspect somewhere here, you are going to palpate a head of fibula that is placed a little deep. Then on the anterior surface, the sharp border of the bone that is visible, that is the shin or anterior border of the tibial bone. That is the part of the bone that gets hit when you are walking in the and hit a furniture, and that's the border that hits the ongoing structure. Then between the anterior border and then on the a little on the back will be the medial border, and between them there will be the medial surface of the tibia, and this surface of tibia is subcutaneous, and the skin, there is skin, superficial fascia, and directly there is periosteum. Then there is malleoli. Here are the two malleoli, the lateral and the medial ones. Regarding we will be discussing leg in three compartments: extensor, lateral or peroneal, and posterior compartments. However, the medial compartment, the medial surface, it is subcutaneous and it only contains the saphenous vein and the cutaneous nerve going through it, that we will discuss in the upcoming slides. Subcutaneous tissue, below the skin will be subcutaneous tissue or fascia, and it will have nerves, veins and lymphatics. So it may be fatty on each side, and on the medial aspect it is only lying directly on the top of periosteum. When talking about the veins, the major vein that is on the medial aspect or on the anterior aspect of the leg is this one, that is the great saphenous vein. It starts right here from the dorsal venous arch. From the medial aspect it goes up, very importantly it runs in front of the medial malleolus, and as it goes up, it goes up behind the knee on the medial aspect of thigh to the saphenous opening. In the leg it is running on the medial aspect, and when it goes, it has perforators that connect the superficial vein as shown in the picture right here. Like here, this is the superficial great saphenous vein, and here are the perforators that connect with the deep veins. There are many perforators. I'm not going into the much detail right now, but there are connections that connect the superficial vein to the deep vein. Then comes the lymphatics. They follow the great saphenous vein and they follow them all the way to the these nodes. These are the vertical, they are the superficial group of inguinal nodes. They are further divided into lateral horizontal group, medial horizontal group and vertical group. So the vessels accompanying them are falling into the vertical group of superficial inguinal nodes. Just keep in mind, from the big toe, from the medial aspect are going to the superficial inguinal nodes. On the lateral aspect that we'll see in the posterior compartment of leg are going to the popliteal nodes. Then comes the cutaneous innervation. You can very easily divide it into two parts, the lateral and the medial one. The lateral part, that is and the medial part. The medial part over the tibia, this one, this is supplied by the branch of femoral nerve, and basically there is one branch that is the that is a saphenous nerve. This one, this is the saphenous nerve that supplies the area of the medial aspect of whole of the leg. This is a picture from Gray's Anatomy, and you can see this is the area that is supplied, and it goes all the way to the ball of the big toe. Ball of the big toe means the base of the big toe, and it has some other branches like the branch that is going in front of the that the branch that is going below the knee is the infrapatellar branch, and then there will be two branches that were going front and back of the malleoli called anterior and posterior branches, and so on. On the lateral aspect, here is the lateral aspect. This is basically supplied by the, this whole area is supplied by the common peroneal nerve. It is further divided into two parts. This whole part, as shown in the blue right here, this is supplied by the lateral cutaneous nerve of the calf. It is a branch of the common peroneal nerve that separates from the popliteal fossa, and below the half of the calf, this area shown in the green, this is all of this nerve is the superficial peroneal nerve, superficial fibular nerve that supplies the lower aspect, lower half of the lateral surface of the calf, and it goes all the way to supply the dorsum of the foot also. We will discuss it further in the dorsum of the foot. Then there is deep fascia. The deep fascia of the leg overall covers it like a stockings, like a sleeve from foot all the way up to the thigh. This is called fascia lata. It has local thickening, like we have discussed fascia lata in the thigh. And here the thickening that is important is this one, extensor retinacula. These are the thickenings that hold the tendons below it in their place and prevents them from bowstringing. So when talking exclusively about the leg, there will be extensor retinacula. It has two parts. This is the superior extensor retinacula, that is technically a part of leg, and then there is inferior extensor retinacula, that is technically a part of dorsum of the leg. So in this lecture we will discuss this extensor retinacula. So it is basically attached to the anterior surfaces or anterior borders of fibula and tibia, and it has the tendons of hallucis, tibialis anterior, digitorum passing between them, and also the anterior tibial artery along with the deep branch of common peroneal nerve. We will discuss this again as we will conclude the muscles and structures. That brings us to the boundaries. So to give an idea, here is the fibula with its posterior, anterior and lateral surface, medial surfaces, and there is a tibia with its anterior, medial and posterior surfaces. This one is the interosseous membrane. So there are then the circle that is surrounding is the deep fascia that is surrounding right here, and then there are two septa that are important in dividing the two. There is the anterior intermuscular septa and posterior intermuscular septa. So this is the part that we are going to discuss in this lecture. So it is bounded by tibia, medial surface, medially, interosseous membrane on the posterior aspect, anterior intermuscular septum on the lateral aspect, and the part of fascia lata on the anterolateral aspect. So these are the components, and then the contents. These can be shown in this picture. These three muscles and the vessels, we will see them in this picture here. So it has three basically, when talking exclusively about the chamber, it has three muscles. There is tibialis anterior muscle, there is extensor digitorum longus muscle, and there is extensor hallucis muscle, the three muscles. Then functionally speaking, dorsum of the foot is also considered a part of it, that contains and also there is a peroneus tertius muscle, like this one, this one, tertius or brevis muscle. The four muscles are there, and then including that there will be artery and vein. Artery is the anterior branch of tibial artery, anterior tibial artery, and nerve will be deep branch of common peroneal nerve, deep peroneal nerve. Artery is medially placed as compared to the arteries. Thank you. This was the overview. In the subsequent lecture, we will dive into the functions of the four muscles that we just discussed. Then we will move on to the artery and nerves.